Good morning, everybody. And I'm going to try something new here. A couple of you have requested that we continue to have a discussion of the news one way or another. So I thought in the mornings I would film a little video about the latest news and put it out there and see what happens. Okay. Anyway, want to start with just the latest numbers regarding the coronavirus, since that's the situation that's dictating what's going on with us. There's currently 142,801 cases of the coronavirus in the United States, and that's as of this morning, and that's from NBC. And that is 56,000 more than on Friday morning. This is Monday morning, 30th of March. So just 3 days ago, there was 56,000 less cases. That's how quickly this disease is spreading, and it's also how much more testing we're doing. Okay, so it's a huge increase. By the way, the United States currently has more cases of the coronavirus than any other country, even though there's some who are questioning the validity of the Chinese numbers. They just don't appear to add up. But that aside, right now the United States has 142,000 cases, almost 143,000. How many people have died? Almost 2,500. Latest count, 2,472. And by the way, that is 1,200 more than Friday. So we have seen basically a doubling in deaths in 3 days. Okay. How many tests have been run? 852,000. So we still have not even tested 1 million people. This is after the administration said we would be testing millions of people, and that was several weeks ago. So we have tested 852,000, and again, that is significantly more than were tested last Friday. Last Friday, that number was about 500,000. So it's gone up 300,000. So we're seeing almost a doubling of tests, almost a doubling of deaths, and a huge increase in the number of cases, too. It's gone up by a third. Okay, now the news that came out about all this is that, well, the Dr. Anthony Fauci, who is the president's expert, he's the head of the, let's get his title. Do I have it here? I don't have his title. He's director of infectious diseases in the United States. He is estimating that based on current models, 100 to 200,000 people could die because of this coronavirus. And that's why the president announced that we're not going to try to open up by Easter, a mere 2 weeks away, but instead we're going to basically be in this shutdown, this social distancing, this don't gather in groups of more than 10 people for at least through the month of April, which is starting in 2 days. So basically, March, like April, is going to be a shutdown month, is what the president is recommending. And state governors who are on the front lines of this, they're also saying, yeah, that's pretty much what's going to happen. We're going to have to shut down. Okay. By the way, this is my cat. My cat's name is Pluto, and Pluto wants to join in on the discussion. Okay. So let's see what other news is going on. Yeah, the 200,000 people who are dying, people who are interviewing other people. Like, there's my cat's tail now. People who are interviewing other people, um, surveyors, reporters, they're discovering that a lot of people are fearful as we go through this. We see the video of what's taking place in New York City with the refrigerator trucks filled with dead people. The overwhelmed hospitals. This is the fear about coronavirus originally, that it would overwhelm hospitals, and that's what's taking place in our largest city in New York. But on top of that, what reporters are detecting in people is fear, just plain fear. And I think a fear of catching this disease, a fear of dying, even though the odds of dying from this disease are about 1 in 100. So I think that is all stuff that's going on in this. Okay. Um, in Texas, there is, as of yesterday, the governor, Greg Abbott, said that there's 2,552 cases, 2,552 cases, 34 deaths, and we have tested 25,000 people. So, again, we're a state of almost 30 million people, and we have tested 25,000 people. And that goes to the heart of public health here. How can we contain a disease if we aren't testing for the disease? And I think when we look back on this disease, a couple years, we look back at what we've done. I think what everybody's going to be talking about is there wasn't aggressive testing at the beginning like there was in other countries. Okay. All right. Here in city of Abilene, the mayor of Abilene, Anthony Williams, is going to be announcing a limited shelter in place that's going to start. My understanding is going to take effect tomorrow morning, Tuesday morning. But we've tested 315 people in a city with 120,000 people in it. There's been 9 positive tests. The first positive tests were discovered on Thursday. So in just the 4 days since then, we now have 9 positive. 6 of them are found in one place, Disability Resources. And, just a tragic situation. So far, there's no deaths there. And Disability Resources was getting a deep clean there this weekend. There's been 172 negatives tests here in the city of Abilene, but, and this is part of it, 134 pending. So 315 people have been tested. There's 134 still pending. Not only is there a lack of testing, it's taking a while to get tested. It's just taking a while to get the results back from the tests. And that's also troubling too. Why is it taking so long? Supposedly help is on the way. Abbott Laboratories, one of the largest drug manufacturers, is announcing a new test that's going to be available soon, they say, and you supposedly will have the results in 5 to 15 minutes. That's the kind of thing that we really need to find out if we have the disease, how fast it's spreading, what areas need to be contained. That's really what's going on. Just a couple of other final points as we conclude this. Number one, it is interesting to note that the president is talking and the president's making recommendations, but we've talked about federalism in class. And under the principle of federalism, the federal government has its powers, the state government has their powers. And the state governments are the ones that are responsible for shutting down things. They're the ones that are putting the orders for us to stay in place, to shelter in place. It's the state governments, it's the city governments, which are arms of the state governments, that are really doing the bulk of the action. The weakness here is that the testing is really run under the guidance of the federal government. And the federal government, I hate to say it, just has not come through quick enough in this thing. Okay? So I wanted to bring that up. Not sure if there's any other points that we need to talk about. So I'll just end it right here. I'm going to be trying to do this every day and hope it's worthwhile. Take care.